My name is Maribel Garcia Guzman, and I'm doing my research assignment on paralysis. One of the main reasons I chose to do this on paralysis is because my brother and my sister both have a couple of friends who are paralyzed from the waist down, and I really wanted to be more informed on this topic. I will begin by describing paralysis. Paralysis is the loss of movement and often feeling in a body part or parts caused by nerve damage. Paralysis can be congenital, caused by an accident, or caused by an illness. An example of paralysis being congenital is a child born with facial paralysis, caused by a disorder such as Bell's palsy. An example of paralysis caused by an accident is a person may be involved in a motor vehicle accident that causes damage to the spinal cord, resulting in paralysis. Finally, an example of paralysis caused by an illness is a person that became infected with polio and the virus attacks and destroys nerve cells, resulting in paralysis. There are many types of paralysis. Monoplegia is paralysis that is localized to a single limb. Hemiplegia is paralysis that affects one side of the body, either the right side or the left side. Paraplegia is paralysis from the waist down. Quadriplegia is paralysis in all four limbs or from the neck down. Diplegia is paralysis that affects an area on both sides of the body. For example, it could be both arms or both sides of the face. I will now be discussing the symptoms of paralysis. There are not many signs that lets a person know that they are becoming paralyzed because it is often a sudden onset with no symptoms. However, if a person becomes paralyzed due to medical conditions such as multiple sclerosis, they may notice tingling or numbing sensations in body parts, muscle cramps or muscle stiffness, and decreased feeling in the affected area. Causes of paralysis include damage to the brain, spinal cord, nerves, or junctions between muscles causing paralysis. Common causes are strokes, spinal cord injuries, most often from car accidents, multiple sclerosis, cerebral palsy, ALS, which is amyotrophic lateral sclerosis, or neurofibromatosis. Treatment options for paralysis. There is no known cure for paralysis, but there are many treatment options to help prevent the progression or worsening of paralysis in some cases. Treatments may also help provide comfort or relief to a person with paralysis. Rehabilitation may be used to help treat or improve certain problems caused by paralysis. Physical therapy, which includes the use of heat, massage, and exercise to stimulate nerves and muscles. It is often used to prevent muscle atrophy, which is the loss of muscle tissue due to lack of use of the muscle. Occupational therapy is also used to help teach people with paralysis how to perform some of their daily activities to help lead a more independent life. Medications can be used to help reduce pain, muscle stiffness, infections, and muscle spasms. Psychological aspects of paralysis. Both people who are born with or develop paralysis later in life experience many mental health issues. Depression and anxiety are some of the most common psychological aspects that people with paralysis experience. Symptoms of depression include anger, sadness, suicidal thoughts, and constant fatigue. Often, people who are depressed will spend most days in bed and find it difficult to get up in the mornings. Symptoms of anxiety include panic attacks, trouble breathing, constant worrying, and irrational fears and thoughts. Another common symptom is rapid heartbeat. People with paralysis may also experience lots of frustration and feelings of helplessness. People may often feel as though they cannot lead a normal life because they have paralysis. It is important to remember that there is no such thing as a normal life. They may feel as though they cannot have a romantic relationship with another person. They may feel as though they cannot lead a normal social life. They may not be able to work in the career field they desire. They may also struggle to find a job, resulting in financial issues and feeling like they are a burden to society. Prevention of paralysis. Paralysis cannot be prevented most of the time. An accident can happen to anyone at any time, or a person can have a medical condition that results in paralysis. However, there are some things that can be done to reduce the risk factors of becoming a person that is paralyzed. Wearing seatbelts, helmets, and protective equipment when necessary is one of the best ways to reduce your chances of becoming paralyzed. Pregnant women should also go to their doctor's appointments and take their prenatal vitamins to prevent premature birth, which often results in cerebral palsy, which can cause paralysis. Many people become paralyzed after having a stroke. So if you can prevent a stroke, you can prevent becoming paralyzed. To prevent a stroke, it is important to maintain a low blood pressure, not smoke, manage diabetes, exercise, and eat healthy. Essentially, lead a healthy lifestyle. I will now be discussing people who are paralyzed and are well known in our society. I will begin by talking about Christopher Reeve, who was a famous actor in the 1950s and played Superman in several movies. Christopher became paralyzed after a horse riding accident. He was paralyzed from the neck down, meaning he was quadriplegic. He founded a foundation to help improve the quality of life of people who are paralyzed. His foundation has helped and continues to help countless people. Next, I will discuss Stephen Hawking, who is one of the most influential and important scientists to have ever lived, and he was a person who had quadriplegia. He is an inspiration not only to people who are paralyzed, but to people of all disabilities. His paralysis was caused by ALS. Next, I will talk about Daryl Mitchell, who was and continues to be an amazing actor who became paralyzed after a motorcycle accident. He continues with the same successful career from before the accident, which serves to show that people with disabilities can live a high quality of life when they have support from family and their employers. Now I will talk about Amy Van Dyken, who was an amazing U.S. Olympic swimmer and won several gold medals during her Olympic career. After a lengthy Olympic career, she was paralyzed while riding an ATV in 2014. After her accident, she went on to compete in other competitions like CrossFit competitions shown in the image. Finally, I will be talking about Franklin Roosevelt, who was a great president who became paralyzed after contracting polio. FDR was paralyzed from the waist down. FDR helped get America through the Great Depression and founded many social needs programs. He founded the March of Dimes to help combat polio and help survivors. I will now be discussing my perspective on paralysis. My perspective on people who are paralyzed is much more positive after this research assignment. Before this research assignment, I felt that being paralyzed would limit a person's quality of life. Although there are certainly limitations to some things, people who are paralyzed can still lead an amazing life. More education needs to be done about people who are paralyzed, and more needs to be done to get people who are paralyzed the resources they deserve to live a full life. I have included a list of my resources for this research project on this slide.